My name is Ian Ludwig. My position at Apuna Pima is currently I'm the Workforce Training Coordinator for the Elder Care Support Program. I'm also the Student Support Manager for the NACCHO traineeships, and I'm still filling in as the educator for the health workers until we recruit to that position. Emails, phone calls, meeting people, establishing networks, talking to external stakeholders, speaking to RTOs, developing training programs. We have over 70 training programs we developed ourselves. We use another 80 through external RTOs. We work with about 18 different RTOs across 6 different states and territories. So we enroll people from Cert 3 all the way up to a Masters and everything in between. If there's no training out there, we create it. So if there's cold chain management or medical terminology, etc., we create that. So yeah, we learning and development. We do everything so that people can learn and that they can develop to support the Cape. I used to go up to the Cape quite often as an educator. As I've taken on these other roles, my trips up to the Cape have been curtailed somewhat. So, but look, I'm the Elder Care Support Regional Coordinator, so I'm looking after Palm Island. I go west out to Mount Isa, Gidgee Healing, north to Bamaga, to the NPAWS up there, Mariba, which is up the range here, Mullingu, and also our Apuna Pima staff, so the Cape. So yeah, I've got a pretty big footprint myself to look after. Yeah, there's 16 staff in those areas that I coordinate their training and their onboarding into how to learn how to be elder care support specialists. The favourite part of the job is that you're actually giving back to the communities. It's working in your own community. The favourite part is also travelling on country, having that good yarn with the mob from community, catching up with old friends, you know, old schoolmates. We went to boarding school together, hadn't seen each other for years. So that's the best part of the job, is that you can make new friends, you can reconnect with old acquaintances, and then you can actually use your skills and knowledge and experience to better their lives in community. And then they can turn around and say, gee, I didn't know you do that. Yeah. So that's the best part, is that, and also on top of it is that now we get to look after our elders. The Australian government is starting to help us a bit there in that. And so, you know, there's another new favourite part of mine now, is that I get to spend time with my elders and make sure they get everything they deserve. Any of these young fellas out there that, even if you're not thinking about a job in the health sector, if they're not thinking about a job in the health sector because they're saying that, no, that's not me, that's, I'm not interested in, you don't really know until you're actually gonna go. So I think I would say to every young person out there that's not thinking about coming into the health industry, or they're thinking about coming into the health industry, is do a bit of work experience, volunteer at one of our RTOs, attend our career expos with your school, and speak to some of your local community-based health workers, because they can give you a lot more insight into what happens in your community. So I would encourage as many, especially males, you young Indigenous males out there, if you're out there, you really need to look at this as a career, because you'll have a job for life. That's the thing. Everyone's going to need health all the time, but you can go mining, but they're going to run out of resources soon, so your job's going to finish. But come to work in health, because you'll have a job for life. Health industry is a typically female-orientated profession. It's been that way since the past. You know, you got Florence Nightingale, you know, Mother Teresa. These are all top female figures. The only male figure they had in there at the time was that male nurse Greg Fokker on Meet the Parents. You know, Hollywood Hollywood just destroys that. So there's not a really good lot of male role models out there to encourage our Indigenous males into the industry. But look, if you come and look at Apuna Pima, the Cape York Health Council here, you'll find there's a lot of Indigenous males here who work in the health industry and disability, aged care. Yeah, I'd encourage you to get into that.